I'm Barb Van Summeren, and we're having a remote care conversation with Chief Product Officer Michael Moore at MD Revolution. Hey, Mike.
Hi, thanks for having me.
Mike, you guys have been really forging a new path for remote care at MD Revolution. Can you talk a little bit about the motivation behind that and how that's shaping your product strategy?
Sure. It all really starts at the patient level. We really believed that technology and the time in healthcare was right for having new ways in which to engage and support patients outside of the medical practice in a way that really aligns and takes care of them. And that has always been the mission of MD Revolution, was to figure out how to get those services available for patients and the best way to do that. And in doing so, we really realized that number one, we needed to focus on the patient, which it doesn't sound like it should be a change, but it really meant looking at this in a way beyond what might be a diagnosis or a health challenge that the patient is having, and really figuring out how to support them as a whole person in a way that is really able to connect them, support them, and to help them on their health journey. We also realized that clinical care team members were critical in this. And in order to effectively use the, smart, capable, and compassionate clinical teams that we had, we needed to develop tools to let them work, use technology effectively, and really allow them to focus on patient engagement. And in some cases, take away administrative or other tasks that they're not adding value to, so that they can be really focused on what they love to do most, which is take care of patients in a one-on-one setting in a way that they can, make the most value for the patient and for the practices who hire us to do those services. So that meant really, we saw the gaps in electronic health records that were built around an office visit, and honestly did not know how to track activity that happened in between the next office visit, much less have a way to proactively plan and really execute on those programs at any scale. So we began building our platform that works as a clinical care management tool with really from the get-go connected devices and engagement tools and channels to communicate with the patient, all around a care plan that's, prescribed by the doctor, but, really brought to life by our care teams and by technology, and really incorporate that into the day-to-day of our patients.
Yeah. I remember talking to Jean at your company, the CIO, Jean Balgrowski, and she had mentioned these new technologies. They can actually be developed faster than they can be adopted. And so helping the teams along the way and adapt those and having it work all together is really the trick, isn't it?
Yeah, and it's understanding that these aren't, these may be made available to patients from prescribed purposes like remote patient monitoring or chronic care management. But to a patient, it's one journey. And to us, remote patient monitoring is just a more effective, data-driven health coaching and care management. And so using all of those technologies together in a way that we're not just watching a vital and only doing that allows us to provide the most value for everyone involved. The provider, most certainly the patient, and at the end of the day, the payers who are making these programs available for those who need it.
Yeah, I really feel like you're forging this whole next generation of remote care, which is really exciting. Can you describe the product offerings that you have at MDR?
Sure. So, from the very beginning of the chronic care management codes, we were one of the first companies that offered that. We've offered that as RevUp, which is the remote care program. It's an add-on service that practices make available for their patients. What that means from a delivery standpoint is we really work closely with the medical practice and the provider to work as an extension of that practice, where our clinical teams work to establish the protocols, reach out to the patient, follow those protocols, really be all of the external touch points that keep a patient engaged from the initial enrollment point of the program through month over month of, an evolution of conversations and activities, but always centered around that care plan. And so really do that in a way that we are able to support the patient, handle, 80 to 90% of all of the interactions, and bring the practice and the provider back in at the points where they're needed to really support the patient and connect them back to the practice for a change in medication or a follow-up visit. but really let them quickly add these programs at a scale that they couldn't without a partner to help them, and really let their office staff focus on the visits at hand and the work that they have to do, and know that they have a trusted partner to be doing that outreach and helping their patients and guiding them in a much more high touch kind of remote fashion in between those appointments.
So that is RevUp, and that is a full service program where you utilize clinical care teams that you guys have ready to
Exactly.
help the clinicians, right?
Yep. Yeah, and then in order to do that, I talked about, the purpose-built tools that we needed to really effectively run those programs. Today, we also offer that platform, which we call RevCare, as a software as a service offering for groups that have clinical care teams and are likely facing some of those same challenges that we met. Lack of tools really built around remote digital care, inability to have remote patient monitoring device readings kind of connected into a care plan that's supporting a patient in a broader journey, and finding out that you need some role specialization, ability to work 24/7, and all those things that our platform helps them accomplish. So we have software clients who are running programs very similar to ours in terms of RPM, CCM, transitional care management, and also, utilization of our RevCare platform to run all sorts of different care programs that may have components that are different, time requirements that are different, and goals that are different, but really all come down to how do you plan the next interaction with the clinician and the patient, and how do you do that in a way that aligns with their care plan.
Yeah, remote care sounds exciting, right? But you're really extending care outside of your regular office hours. So you need systems for that. Sometimes you need people to help, et cetera. That's a whole other source of business and revenue stream actually for practices, right?
Exactly. And we haven't really talked as we do that and we connect that with the practice. Another operating philosophy we had was that a doctor and the practice staff didn't want another system to log into. What they wanted was all of the information and the benefits of this work that's happening on their behalf at their fingertips. So we knew that integrating with an electronic health record was going to be really critical to allowing teams to work as an extension of the practice, both in spirit, but also in reality from a workflow and an integration standpoint. So from the very beginning, we have went at this as an integrated service that is connected through the EHR, where services can be ordered, monitored, and influenced right at the point of care in the practice, and seamlessly connected with our systems so that that information is available to the clinician who's making that next phone call. So we call that original connection now RevConnect, that has grown from our initial electronic health record to now over 20 EHRs that are connected in that same robust fashion, but all making that information available at the point of care for both the provider and for the care teams. And I think the most exciting area that we are working on right now is the extension of those services even beyond, with more things that are connected through RevConnect.
One of the things that I've heard a couple of the folks at MDR talk a little bit about, or MD Revolution talk about, is the fact that you do both full service and you have this software as a service. Do you see that as an advantage for clients?
Yeah, that's a good question. I do see it as an advantage to clients, and I guess in a couple of different ways. One, someone who may want to utilize our services as our software, really, we have a very distinct perspective, and we utilize this software every day for an entire commercial business. And we need to make sure that we mean what we say in terms of workflows that have efficiency, staying on the cutting edge of technology, and really finding out better and more effective ways to deliver these programs. So, we eat our own dog food, I guess, from that standpoint. That's how we effectively do this. And we can do that in a way that it's a big market out there. We think utilization of these services is just a fraction of those who need it. So we don't need to be competitive in that spirit. We want the best tools for patients to make their care more meaningful. But it also is a really good option for practices who may want to grow into managing their own programs, but are really struggling. The expensive part of delivering these programs is at a point where you have a small patient population and you need to staff a lot of people to cover around the clock all these patients and make phone calls. And so, besides offering the two services, we are like fully supportive of groups who may want to start out as a full service practice where we're doing those care calls while they build up, learn, and understand what it takes to manage these things, and then have us train and let their team pick up and deliver that. And we have clients who do one part of the service within their own clinical teams, do their remote patient monitoring and vitals during the day, but around the clock we do it, and we make their outreach calls for health coaching. So there's a lot of variety in that. And I think at the end of the day, having those choices is really valuable for practices who want to be prepared for the future, but also really make the best choice of how to use their resources for taking care of their patients.
So, Mike, a lot of people are talking about next generation remote care as it relates to true connectivity and really how these systems actually interact and connect together. Can you speak to a little bit of that at MD Revolution?
Absolutely. I think that's some of the most exciting things we have really that we're working on today. So from the beginning, our approach to delivering remote care for the patients has always been reliant on a strong and deep integration with the electronic health record. So we did that out of necessity originally. We wanted to make sure that the providers were able to work in the tools and the workflows that they already had. And at the point of care, to be able to enroll patients, to be able to monitor and see the progress of the care program, and also to be able to, efficiently run billing operations and things for claims. And so that meant really a thorough and a deep approach to those integrations that was bidirectional and really built around that provider having at their fingertips all of that information, but also the information of the health history, the medications, diagnosis, visit history, all feeds into our system so that the care delivery team is equipped with that information and can really personalize the care to the best ability with where the patient's at from a health history perspective, and all the work we do then to engage with them. So we knew that a provider didn't want to go to another portal, and that our teams really needed these focused tools. So that integration layer that we call RevConnect became very important. And we started years ago with the first EHR integration and have now built up to over 20 EHRs who have that sophisticated kind of interconnectivity, really driving the care now around multiple services that can be enrolled and managed for the practices.
Let me ask you this question. It's no small feat to integrate with an EHR. I know that. And when you're bidirectional, does that mean the actual clinicians can work in their own systems and don't have to learn a new system?
Yeah, absolutely. So the practice staff still manages the patient in the same way that they would, and they can, set a flag or an order set that enrolls the patient, and they can see at any time if the patient's got their device, where they are in participation, even the exact readings coming back in from that device right into the flow sheet within the EHR. So now we're really able to kind of commit to the promise of more data-informed care for the patient by having all of that information that we're collecting along the way back into the patient's chart, where the doctor can use it to inform their next visit and their decision making.
So you're actually listing some of these partnerships that you have on the site through your marketplace. Can you talk to a little bit of that? So if I'm looking for my own EHR or some of those folks, I can actually check them out on your site and see if you have a integration with them, right?
Yeah, so we have a new Connect marketplace that lists not only all the EHRs, but all the other devices and data partners that we have connected. So what started as EHR integration has now really grown to a new, really, I think that the new space in healthcare is what is all of the data that should be available to make sure that that next right care action that we're doing with the patient is informed by the EHR, but also by analytics, by devices that are connected, by AI tools that can be looking for gaps in care and identifying those, all of those things. And so what started as EHR integrations, RevCare now includes those EHRs, a whole set of a variety of different device partners that we work with that can connect directly to our platform, technologies and data that help power our workflows, analytics partners, all those things that really add meaning and purpose to the point of care and make sure that the patient is able to be supported, but also that the data we are collecting at every touch point now can feed back and really close the loop to go back into their analytics system so we can be spotting screenings that need to happen, incorporate that into the care, and actually know when we've been able to do that for the practices.
Yeah,
So,
it sounds like this is really the definition between from good to great care, right? Is this whole connectivity and this ecosystem that works together so that your data is actually integrated throughout all these systems. Talk about devices, because there's a lot of devices out in the marketplace right now. And it's kind of an advantage for people if they can actually upgrade and use the latest devices on the marketplace. Does your system allow for this flexibility for devices?
yeah, so device flexibility we think is really important. So we're device agnostic. We have some partnerships and some advanced features around ordering and logistics with a few partners, but we have a whole variety of partners that are connected to our system already. So each time we make one of those connections to smart meter or telehealth or iHealth or any device partner that we work with, Tenovi is a partner of ours. Once we make those connections, we make them in a way that any client or partner that we have will be able to take advantage of it. What that means is, in reality, it's just a lot of great choices. And why those choices matter is because most of our clients have switched technologies that they work with at some point in the care. Many of our practices have changed whole electronic health records partway through their program. Traditionally, they'd have to stop their program, lose all their data when they switched in EHR, and have to figure out how to do that in the next one, or change portals that they're using to monitor and manage the patients because they want to change the devices. So, we really built it with around the patient. So those things are all adaptable and can work together. Also, some of our practices have multiple EHRs and want to have that, able to be connected and the patients managed in the same way. The other piece is if a group has a hardware manufacturer that's got a portal that they can use, we think those portals are great, but they're also limited. They're oftentimes not built to figure out how to work this into a broader care management program and the compliance services. But also then you're forced to use different portals to take care of different patient populations. So we can, from one point of care, we can manage a patient who's in a heart failure program, and also that is on a continuous glucose monitoring regimen with a Dexcom or Abbott Freestyle, all in the same care path and the same program components and processes that are supporting someone that's in a very different device.
Yeah,
So we think
as I
that
think about
really adds
this,
up.
yeah, as I think about this, if you have large patient populations with multiple conditions and they have to be treated in multiple ways, you need this kind of flexibility.
Absolutely.
Okay, so I did hear before that if you actually, some of the companies actually started as device makers and then created a remote care system, but that actually has limitations as well. So you're really an ecosystem hub for a company, which is really the opposite way it works, right? So you've actually thought about connectivity first, right?
Yeah, and we were fortunate in that the founding of our company really started around personal health coaching with the connected devices. So we have always thought of those things as more data to inform that support that the patient needs. So to us, it's really about being connected, about being supported, and really then the prevention part of that, which is the goal, which is to keep people, healthy or to help them kind of manage chronic illness. So to us, having more tools and more sources of data is right in line with what we've always needed and felt really made for the most benefit of the outreach we're doing and helping the patient manage their care.
Yeah. So I'd be remiss by not asking a little bit about AI. Talk to me a little bit about what you're thinking about in this space. Have you already developed some AI models, or are you in the market for that partnership wise?
Yes, yes, and yes. So we have AI that is at work in a lot of areas for us today. So we have AI models that are looking at, personalized content and recommendations for patients, looking at their health history, seeing what they may be focused on from a vital standpoint, and really knowing how to suggest micro challenges for them, and really giving some personalized hints and tactics to change some behaviors around their health. Also looking and utilizing AI around just recaps and summarization and things like that aid our clinical team in really having effective and good documentation of the interactions that they have. But we, as we looked at the emerging technologies and seeing it, we also realized that much like data analytics, there were going to be areas of groups that are really investing and building out really amazing AI models. And we wanted the ability to connect any of those models to our system. So like devices and like EHRs, we look at those models as a way to be able to influence our care. And at the end of the day, all of these models have one thing in common, is they're going to end up with something that's either going to be an action that a care team member needs to take with the patient, a suggestion for a patient, or oftentimes an alert of a situation that needs some help. And that's really the areas our platform is built around for, empowering the clinical team to deliver this care. So we really looked at, yes, some specific use cases of AI within our company, but also how do we make sure that we're able to connect to any AI model and translate all those things to what we think it comes down to, which is now what? Once you have that information, what do you do? So whether that be incorporating an agent at specific points of care, or powering more informed tasks that take care of escalating concern that AI can spot better than the human eye, or even just machine technology looking at readings. We want to be prepared for that so that we have the ability to grow with our clients, and also where they have these technologies incorporate that right into the point of care.
Yeah, this is really opening up a whole new field of study for us with AI, and so many people are taking different avenues. It's going to be exciting. So, Mike, on RevCare, I think I've heard that this is the platform that's all about scale and really managing many, many patients at once and conditions at once. Can you speak to that a bit?
Sure. Yeah, we talk about scale a lot, and I think it's really important to say exactly what we mean by that. To us, scale is the ability to put more patients into these programs and not have to add people resources at the same pace. And so really finding a way that clinical teams can support more and more patients and efficiently and effectively. What that really means within RevCare then is there's a point at which we really need to be able to support specialized functions within the care delivery teams. And that can be either multidisciplinary from an area of focus, or just separating out functions so that the people who are making outbound calls have the most efficiency to do that. So what used to be a really kind of threshold where they could manage 300 to 350 patients per clinician, we're now seeing groups that are, around remote patient monitoring, other things are closer to 1,000 patients per clinician, because they can manage those touch points efficiently, still have where there's time required to be spending that time. But when there are items that can be supported and done more efficiently, having workflows that do that. And, and that means, as we said, having all the clinical tools available. So health coaches who are digitally messaging with patients have ability to do that and have even more touch points. So that means getting patients to use our digital technology or texting. And that's why we offer those, of course, to our full service patients. But our SaaS clients also have all those tools white labeled around their program or their brand, so that their patients are really feeling like it's a very cohesive experience with their practice.
Okay, let's switch gears a second and talk about the future of this care. Talk a little bit about what we can expect moving forward. What's next for next generation remote care?
Yeah, we're really excited for what's next. So we have watched the slow adoption of chronic care management from explaining to practices what it was to now everyone really understanding the value of it and the challenges of it. Remote patient monitoring got added into the mix and really seeing even more expansion. So very excited about some technologies around remote therapeutics management that are looking at cognition, medication adherence, all sorts of really specialized tools to help a patient and have kind of data accountability and tracking where we need it to help a patient be successful. Most exciting, though, is what Medicare is seeing is the evolution of its own programs, and especially around advanced primary care management. So it's a set of proposed rules that are really changing the game for care delivery and care management. And it does a couple of exciting things that we feel are long overdue. One, it just really aligns the objectives and the rewards for a primary care physician to incorporate all of these services for their patient and take what Medicare has proven is effective and work that into a program that's even more robust and that more patients can be part of. What it's also done is said it is not a one size fits all for patients. So today, Medicare says 20 minutes for every patient if that's the only thing that matters. And we think that's valuable time and we're all for it. But the reality is patients have different needs based on their health history, their risk factors. So data analytics, risk stratification, and the measurement of that value as a core component of the program and allows for the level of care to vary based on the risk of the patient so that patients who are fully able to get the benefits of the program with lower touch have that opportunity from being enrolled in the program, and the clinical resources can really be focused around the touch points that they offer the most value to and for the patients that have the highest risk. So we think that's going to be a really exciting time for these care programs. And we're also really confident that the way that we have connected our care and the data that we already incorporate into care in that broader picture of how to take care of the patient has us really well positioned as a company to make sure that our practices can be very successful with those programs.
Yeah. Shift to value-based care, not one size fits all, right? And moving away from this time, it's all about the time versus it's all about the care and proactive care for those people. That's the right direction to go in for sure.
Yep. So we'll be talking a lot about that with our clients as we watch the changes in the programs, and also adding to our RevConnect ecosystem data analytics partners who will be able to supply some very specific data analytics that looks at what our programs are doing and what's happening with the patients, but also work directly with the practice to get a broader sense of the savings across their patient population and really keeping them aligned with the value-based goals of these programs.
Yeah, and those programs are definitely all about analytics, sharing it, and their requirements are around connectivity. So you guys are well positioned. Well, great. Quite a bit happening with you guys. And really, it does feel like next generation remote care when you're telling me about some of the roadmap and the innovations that you guys are working on. It seems like it's all pointing to this notion of more personalized and proactive care. Is that where we're headed, the smart care?
Yeah, I mean, certainly smart care. And I think as well, healthcare's approach to these services is also changing. We're very excited to see some changes coming in proposed plans around how care gets delivered and how those services are aligned. Because now the advanced care management as a concept is also looking at, what care is available for a patient, but also what level of care a patient should get based on risk, based on stratifying them and seeing how they fare so that we can take all these value-based components and incorporate those into care program and adjust the level of care based on the risk and need. So I think that is going to mean much more adoption from a provider standpoint and also begins to say, hey, let's really reward things that are proving value for the patient, but also supporting value-based care initiatives in reducing costs, addressing complexity earlier in the cycle, and really letting that be data-driven from the start.
Yeah, I mean, with those different levels that are being addressed, it's really not sick care anymore, right? It's really about proactive longevity care. I keep hearing the term health span, not lifespan. So I think a lot of people are concerned about living better as we age for sure and addressing things ahead of time, not after you need it, the care.
Yeah,
Well,
absolutely.
great. Thank you, Mike. Thanks so much for talking to us today. And as usual, you are a wealth of knowledge around where we're headed for next generation remote care.
Thanks for having me.